evaluation of autonomic neuropathies. So, autonomic nervous system is essential for cardiovascular, gastrointestinal, and thermoregulatory homeostasis. There are two types of autonomic nervous system: sympathetic and parasympathetic nervous system, where sympathetic is responsible for fight and flight response, and parasympathetic is responsible for rest and digest response. Factors which influences autonomic nervous system are positioning, emotional state, ingested food, drugs such as which reacts with sympathetic and the parasympathetic nervous system, like beta blocker, anticholinergic, sympathetic blockade, like in regional anesthesia, initiation of positive pressure ventilation. And in those conditions, autonomic nervous system should be intact. If it is abnormal, it will lead to silent MI, cardiac arrest, and respiratory arrest. Causes of autonomic neuropathy is the most common cause is long-standing poorly controlled diabetes mellitus. Other causes like Parkinson's, amyloidosis, hypothyroid, and other conditions which will lead to peripheral neuropathy like chronic alcoholic B12 deficiency. In evaluation of autonomic neuropathy, the most important part is the clinical history, symptoms, and signs. So we have to elicit the history of palpitation, dizziness, exercise intolerance. In case of GI, early satiety, fullness, weight loss, loss of sweat, any history of constipation or diarrhea, and history of sexual dysfunction and bladder abnormalities. So the symptoms or signs are in cardiovascular system, it is resting tachycardia, exercise intolerance, orthostatic hypotension, silent MI. In GIT, gastroparesis, fecal incontinence. In genitourinary system, neurogenic bladder, erectile dysfunction, retrograde ejaculation. In pseudomotor system, it is loss of sweat, heat intolerance, gustatory sweating, dry skin. There will be a poor dark adaptation of pupil. And evaluation of ANP, the prerequisites are we have to rule out any end organ failure or concomitant illness, and optimization like withholding of caffeine and nicotine at least 3 to 4 hours before testing, alcohol abstinence for at least 8 hours. If possible, to stop anticholinergic and sympathomimetic drugs at least 24 to 48 hours before testing. And patient should be laid down or seated for about 30 minutes in a quiet room with neutral temperature and humidity. For testing, there are several testing batteries are available, of which E-Wing battery is the most popular one, which consists of analysis of heart rate variability and analysis of blood pressure variation. The analysis of heart rate variability, which is also the test for parasympathetic control, which includes heart rate variability due to deep breathing, lying to standing, and Valsalva maneuver. Analysis of blood pressure variation is also a test of sympathetic control, which includes blood pressure variation on standing, sustained hand grip, Valsalva maneuver, and cold pressure test. So heart rate variability, it is known as respiratory sinus arrhythmia, where heart rate normally increases during inspiration and decreases during expiration. This heart rate variability is because of this autonomic nervous system. If it is absent, then which leads to autonomic neuropathy. Normally, it is more than 15 beats per minute variability. If it is less than 10 beats, it is abnormal. We have to instruct the patient to take deep breath quietly and deeply, approximately 6 breaths per minute. And it is observed by simple observation or palpation or by using specialized monitors. These tests are not applicable to the patients above 60 years of age due to decreased vagal tone or decreased beta receptor responsiveness. Then response to standing up. If a patient stands after a supine position or a sitting position, because of pooling of blood, there will be a drop of BP and there will be a reflex tachycardia. This tachycardia is maximum at 15th beat, and there will be a reflex brady or a decrease in the heart rate maximum at 38th beat. So this is calculated as 30:15 ratio. where longest RR interval is divided by shortest RR interval. If it is more than 1.04, it is normal. If it is less than 1, then it is abnormal. Valsalva maneuver, which is a forced expiration against a closed glottis. So we have to ask the patient to exhale forcibly against a mouthpiece, which is connected to a sphygmomanometer with a resistant pressure of 40 millimeters mercury. There will be resulting in the sudden increase in the intrathoracic pressure and also the intra-abdominal pressure, which results in a hemodynamic response, which is characterized into 4 phases. Where phase 1, because of increased intra-abdominal pressure, increased propulsion of blood into the peripheral circulation, there will be increase in BP and a reflex brady. In phase 2, because of prolonged increase in intrathoracic pressure, decrease in cardiac output, decrease in BP, and there will be a reflex tachycardia with increased peripheral vascular resistance. In phase 3, when the exhalation is stopped, the intrathoracic pressure is released, but even then, this sudden release of positive pressure will lead to expansion of pulmonary vascular bed, which leads to a drop in the BP and a reflex tachycardia. In phase 4, after a normal venous return output, there will be an overshooting of BP and a reflex bradycardia because of baroreceptor reflex. If these variabilities are absent, then it is autonomic neuropathy. Caution in patients with pre-existing coronary artery disease, valvular heart disease, and congenital heart disease, patient with retinopathy and intraocular lens implantation. Then the blood pressure responses, orthostatic hypertension. If a patient stands from a sitting or a lying position, there will be a drop in the BP, which is not usually more than 10 to 20 millimeters of mercury. If the systolic BP drops more than 30 millimeters mercury or the diastolic BP drops more than 10 millimeters mercury, then it is known as orthostatic hypotension. Sustained hand grip test. Sustained muscle contraction causes a rise in the cardiac output, which leads to increase in the systolic BP, diastolic BP, and the heart rate. If the response is less than 10 millimeters of mercury, then it is considered abnormal. Cold pressure test. On submersing the limbs in the cold water, there will be increase in the BP and heart rate because of the sympathetic activation. Test of pseudomotor functions. It is a thermoregulatory sweat test. To evaluate the integrity of the central and the peripheral sympathetic nervous system pathway, the core body temperature is raised by increasing the ambient temperature. Then the amount of sweat is measured by using a color indicator. Then sympathetic skin response is the other pseudomotor function test. And quantitative pseudomotor accent reflex test, which is mild electrical stimulation is applied on the skin through intophoresis, which allows naturally occurring acetylcholine to release to stimulate the sweat glands. So it is quantitatively measures the amount of sweat produced after this electrical stimulation. Some other newer techniques are microneurography or noradrenaline spillover test. Then gastroparesis, which is GI response, retain food in the stomach after 8 to 12 hours fasting in the absence of obstruction. It is also a sign of autonomic neuropathy. Thank you, sir.
Hmm. That's a common question that has been asked several times. This answer is covering all the points you have mentioned. So, yes, okay,